Good afternoon, guys. I am here at Women's Cancer Center of Nevada with Dr. Hsieh and Dr. Wisner. How are you guys?
Good.
Very good.
Thank you for having us here in this evening. Let's start off about your background. Where are you from? How is your life?
Life is good. I'm actually originally from New Jersey. Born in New York, grew up in Jersey, slowly moved across the country. Long story short, finished my training in California at USC in Los Angeles, and ended up taking a job here in Las Vegas about 15 to 16 years ago.
Wow, amazing.
Life for me is pretty good as well. So I recently joined Women's Cancer Center, and before that I was practicing here in Las Vegas for about 5 years prior to that, and then I was actually working in Seattle as well. So I've kind of been all over the place, but I'm originally from California, but I'm here now.
Awesome.
Yeah.
Pleasure to have you guys here with us.
Thank you for having us.
How did you get involved in all of this and in this institution and in what you do?
It's a very long process, a very challenging process. So I would say if you're interested in medicine, you got to be ready for that. I think for me, I found an interest, something I actually enjoyed studying. The other kind of classes I didn't really enjoy as much, so that kind of helped me proceed toward medicine. But it is a long haul. You go through 4 years of college, followed by 4 years of medical school. Typically a residency program is anywhere between 3 and 5 years.
Wow.
And then we both subspecialize in a field called female urology. So there's a 3-year fellowship after residency. So we're in postgraduate training for 7 years after medical school.
Wow.
So it's quite a process.
Quite a journey.
Yes.
Quite a journey.
Yes.
How did you feel going to this stage in your life where you were presented with this, something you felt so attached to? And
I mean, I agree with Dr. Hsieh. It has taken us a long time to get to this point. When I look back and I go, hey, how did I get to this point? I made it my first job as a physician. I was 34 years old. So from 18 to 34, I was basically in some type of a training program. And it's been all over the United States, going to different places to find out the best teachers, the best mentors, the best institutions. So it does take a long time. One of the things I joke about with friends of mine is I say that in order to get to this point in my career, I basically lost my 20s. So ages from 20 to 29, when everybody's out there having fun and doing all these fun things, I never really had that. I was training.
Nice. Yeah. Work hard always pays off. Also, what Dr. Hsieh? What is a normal day in the life of Dr. Hsieh? What do you see? What do you experience? How do you walk in your office every morning?
I think we run ourselves pretty hard. This is an extremely busy practice. Just to add a little bit further about this practice, we only hire subspecialists. We have multiple different specialties, including GYN oncology, which is female cancer. Female urology, myself and Dr. Wasserman are in that department, and that's involves more female reconstructive surgery.
Right.
We also have Dr. Browder here as part of our colorectal specialty, and then we have a Heme/Onc doctor. So we have 4 different specialties here, and we only hire subspecialists. All our doctors are very well trained, very specialized. We are primarily a surgical subspecialty,
Right.
So both of us are in the operating room 3 days a week. This is our office where we see office patients, our clinic, and we're only here about a day and a half to 2 days a week. So my average day, either I wake up early, I go to surgery all day, or office here is typically all day also, and we start a little bit later. But our days are either in surgery for the most part, or here in the office taking care of patients after surgery or preparing them for surgery.
Interesting.
Yeah, our practice is pretty streamlined in regards to what our function is within the community. So in Las Vegas, there are a lot of generalists and primary care doctors.
Right.
And our patients are our own patients. However, our clients are also the referring doctors as well. So we have a tendency to get patients that other doctors don't really want to see or can't do these types of difficult cases. So our practice is it's it's patients that really need our services and our
Right.
care.
Very unique.
It is.
Type of field.
It is. It's a unique, specialized, referral-based type of a practice where we are referred patients from other doctors that say, hey, I just can't do this or don't want to do this, and we need to send it on with somebody with some subspecialty training.
Amazing.
So what that means from a patient's perspective or the audience is if they have issues that we treat, in order to have access to our group and having it covered under their insurance, they typically have to go to their primary care doctor,
Right.
their family doctor, or their OBGYN, and then they can make the referral to come see us. So it's a process.
It's a long process.
Patients that have private insurance and PPOs can probably come see us directly, but they would have to check the details of their insurance program.
Okay. Interesting. I wanted to ask you, gentlemen, what is your advice for the audience out there that are dealing with this type of situation in their life? I know there's a lot of media out there, different opinions. What is your advice on how to educate the audience of what you do?
For our specialty called urogynecology, urology, our official subspecialty is long. It's called female pelvic medicine and reconstructive surgery. But female urology is probably easier. We specialize in taking care of women with problems such as incontinence or leakage of whether it's urinary problems or fecal incontinence, what we call pelvic organ prolapse, when typically the biggest risk factor is probably childbirth, when women have large traumatic deliveries that can damage the pelvic floor. As a result, different organs can lose support and fall into the pelvic area. Women commonly feel pressure, bulging, pain in the pelvis, and it's normally a surgical issue. So those are the two or three main problems that we treat. And to summarize, you can say it's reconstructive surgery for women, most of which have had several children and have either prolapse, bulging problems, or incontinence of some type.
And so the message that I would have for the patients is get help, and there is good help out there. When I think about my patients and I think about these women that have led very active lives and have done so much with their lives, and they're a little bit older now, and they have some of the things that we take care of, and those things are urinary incontinence, which is leaky bladder, or pelvic or vaginal prolapse, where things are just kind of falling down. And I think about it, I go, look, these are patients that have had very busy, active lives, and as they get older, they should continue to be active and continue to do the things that they enjoy. And sometimes these symptoms associated with incontinence and vaginal prolapse prevent them from enjoying their lives as they get older. And there is help out there, and we are here to help.
Definitely. It's a great thing what you gentlemen do and what you can provide to the community and to women in general. Is you can help with so many things, self-esteem, reconstruction,
Quality of life.
Quality of
Giving
life.
the patient their life back
Yeah,
is what we
exactly.
commonly say, and that's our goal.
Yeah.
And it's exactly.
Things that you enjoyed throughout your lifetime, you should continue to enjoy as you get older.
Most definitely. Gentlemen, I'd like to ask you one more question. I can tell that you enjoy what you do. You come, this is your passion, this is your profession, you do this every day. What is the best part about your day? When you walk into your office, what makes you want to come back? And what have you found through your journey that you want to keep pushing forward and helping people?
I think the office, well, for me personally, clinic or the office was kind of a chore. It wasn't something I looked forward to. But I think as I matured and built my practice, I moved here to Las Vegas 16 years ago at the end of 2000. And essentially we started this practice from scratch. And to build your patient base, to get to know your patients, to come in and it's basically your baby. I think I look at the clinic or the office from a much different approach. I'm very grateful to have this practice. I think when you come in and you have a family here, it's been very challenging to hire good staff, and over the years we've been able to obtain a very solid staff. It's like our work family here. So the practice has great people. Our patients are wonderful. We take all insurances. We get patients from all parts of Las Vegas. We even have people come in from out of state to see us.
Huh.
So it's basically our baby, and we treat everybody here like family.
That's amazing.
For me, I think there's two things that I enjoy the most. The first thing is the patients. it's kind of like I have 80 grandmothers. All these patients, they're so nice, they're so receptive, they're so nice and fun to talk to. So I enjoy that aspect, getting to know my patients and really being a part of
Their life.
Their lives. Other thing I like about my job is it's very the tangible aspects of what I do in regards to I see somebody, there is something wrong, I know how to fix it and I can fix it well, I fix it and then they get on with their life. So there is a sense of satisfaction that after doing surgery with these hands, I can make somebody better and have them enjoy their lives.
The connection of just changing somebody's life must be indescribable.
It's pretty cool.
Indescribable.
It's pretty cool.
Throughout this journey, what were your major challenges, obstacles? I know you talked a lot about sacrifice, going through all the schooling, the teaching, the studying, to be where you are now. What were those challenges and obstacles?
Yes, well, I think there are a lot of challenges to get to this point. There's a lot of sacrifices. I think growing up, you have to be willing to make the commitment to this field, because this career, for the most part, becomes a large part of your life. You have to make compromises with your social life, with your family life, I think, to be able to complete the training. And then once you've completed training, once you build your practice and try to build a successful practice, that also takes a fair amount of time. So I think one of the hardest issues in getting to this point is sacrificing all other aspects of your life to be dedicated to your career and really be committed to this field.
Commitment. Amazing.
The biggest challenge for me, I think, is finding the right place for me. And what I mean by finding the right place, I mean the right community as well as the right colleagues. So I've been in practice before where I've worked with different people where the dynamic and the people that I was working with really was the biggest obstacle for me to be successful in this field. And I've also worked in different cities where the clientele and the other physicians in town where it didn't really work all that well. One of the nice things about this practice in this city in Las Vegas is that I have both of those things with this practice. My colleagues are excellent, it's very respectful, we kind of prop each other up and make each other more successful than we would be on our own. And the community here is very appreciative as well. The patients are wonderful. We have the right demographic in regards to the number of patients that have the things that we take care of within this city. This is a large retirement community, and there are a lot of very active retired people here. So my challenge was finding my right spot, and I found my right spot here.
Amazing. So throughout all you guys' hard work, the dedication, the sacrifices, it was all worth it because now you have an amazing atmosphere. You love what you do, and you're making a difference. Yes. We want to thank the doctors for having us here at the Women's Cancer Center of Nevada for their time, and we thank you.
Thank you very much.